One of the more common questions we've been getting at the Limerick Chiropractic Center happens to be centering around protein. Doc, how do I know I'm getting enough protein? How much protein do I really need? Hey, listen, I want to increase the amount of exercise because spring is coming. Should I increase my protein intake? These are all really great questions. But one of the very first questions that we have to ask ourselves is that patient suffering from a protein deficiency? See, in the end, we have to recognize what's that starting point that we're coming from. Where is it that we're starting this journey at? Because like anything else, to get to the positive outcome that we desire, we have to know where we're starting from before we can set in those GPS settings to help us create the steps to move forward in time. I'm Dr. Joseph Baker at the Limerick Chiropractic Center, and welcome to our conversation about protein deficiency and how is it impacting your health. Now, let's recognize that protein is absolutely essential for repairing tissue, including muscles, cartilage, and bone. In fact, most of us think of protein as something that just benefits our muscles, when in fact, there are numerous tissues throughout our body that it's responsible to help out. In fact, it's vital for tissue repair and recovery. So we talk about breakdown and repair that comes with the chiropractic adjustment so that our body can be retrained and rebuilt. This is the same process that our athletes go through as they're in the gym lifting weights, stretching and tearing tissue so that the muscle can become larger and stronger. Same thing that happens when we're out in the field running or performing different athletic endeavors. These things tear tissue. It's the protein that allows for those tissues to actually repair themselves and recover stronger and more viable for the future use. Now, what most people are unaware of is the fact that there's actually two different types of protein that the body needs and uses. So for some of you, that might be one of those really big takeaways from our conversation today is that, hey, listen, I didn't know that there's more than one use or more than one type of protein in our body. Now, here's the thing. In the comment section below, I want you to leave me questions. I want to make sure that you're liking this video so that more people in the community can find it. In fact, you should be sharing this with your Facebook friends by just simply hitting the share button. Now, those two proteins, well, let's talk about them because one is used specifically for growth and repair. It can be converted into energy inside of our body. Now, we all know that growing bodies, athletic bodies, are probably going to use an awful lot of this type of protein. But there's another type. It's the blood-borne or plasma proteins, which are responsible for maintaining homeostasis inside of our body. Now, for some, that word homeostasis, well, maybe it doesn't mean a whole lot. Well, it means a whole lot to your body. That balance, that delicate balance that the body needs, the difference between it functioning at 100% or an optimal level and just simply coming to failure is something that, well, we have to work at. And one of the things that the protein does that's found within your system is it helps to maintain fluid balance. Now, that helps to transport nutrients throughout your system. Well, for some of us, that is one of those catch-22s. Yeah, we do a really good job ingesting enough volume of protein, but unfortunately, the proteins that are responsible for transmitting or allowing those nutrients, allowing that benefit to get to the tissues aren't there. And therefore, well, again, the system doesn't perform as well as it's supposed to. Now, one of the things that does, that protein that's within your blood does for us is it helps to maintain the calcium in your blood. In fact, that's 50% of the free floating calcium that's in your system. The other 50%, well, that's bound. It's bound to other tissues. And in fact, you know what? We recognize that when we're seeing an outcome, in fact, when we're seeing that outcome come in a urine analysis test where we're seeing proteins in our urine, that's telling us that it is a clear sign of protein deficiency. Your body is emptying these vital proteins out of the system. Therefore, they're not within the bloodstream for your body to use in order to maintain that homeostasis. Now, many of you are probably asking yourselves right about now, well, what might be some of those signs? What are those things that my body does that helps me understand, well, this is how you're working? Let's remember, oftentimes our body will whisper to us and give us signs and signals that help us understand before it sends us directly into a crisis. So what are some of those ways that we get to hear our body whisper to us? Well, things like increased secretions from the mouth, the nose, the eyes, water gain, swelling in your feet and in your hands. I mean, how many of you, when you look down at your feet, no longer see ankles anymore? Or, you know, those feet of yours look like, you know, engorged sausages. Unfortunately, there's a whole host of ways that our body talks to us, including cold hands and cold feet, cramps that we experience at night, menstrual cramps for our female patients, hot flashes for the more mature female patients, bleeding gums. We don't necessarily think about our mouth as an indicator of what's happening with inside the system as far as proteins, but this is one of those clear things that oftentimes is a response to protein deficiencies. Now, the other thing, which is oftentimes surprising to most individuals, is the fact that when you're not capable of tolerating exercises, well, that's another way of us understanding. But some of the other things, which are probably a little bit more subtle or common, that oftentimes get overlooked: sore and stiff joints, headaches, heartburn, indigestion, gas pain and bloating, constipation and diarrhea, anxiety, irritability, restlessness, and insomnia. Now, for some of you, you're thinking, hey, I hit 3, 4, 5 of those things on this checklist. It might be time that you understand the fact that you probably need to get tested. Now, there are other ways of us seeing and experiencing that protein deficiency. And as a chiropractor, one of those things is, as we're testing your system and as we're looking at your x-rays, the conditions called osteopenia or osteoporosis happen to be one of those reasons that your x-rays demonstrate that you probably have a protein deficiency. Well, if you're not familiar with those terms, osteopenia is when the bone density, the thickness or the rigidity of the bone starts to be eroded. Now, it's not in a crisis situation, but we're seeing it's less than 100%. When we talk about osteoporosis, well, that's a much more advanced form, sort of like looking at the difference between a block of cheddar cheese, which is solid, very few air holes, and then you have a block of Swiss cheese, where you have those large volumes and holes within the cheese itself, and when you slice through it, you can see those openings. Well, guess what? Your bones are exactly the same way. We want to see that thickness, that density in there. We don't want to see a lot of open space that weakens the bones from the inside. But these are ways that we as chiropractors, we oftentimes see the fact that, yeah, there's probably something else that we need to look at in order to help us understand why is the body demineralizing the bone. Now, unfortunately, demineralization, well, there's no age limit. There's no timeline on this thing. You know, we have seen it with younger individuals who have between hereditary, genetics, sometimes environmental, and oftentimes by what we put into our body, the food choices also help in accelerating that demineralization process. The bottom line is that by testing the system, it helps us to detect early on if in fact there's something that we need to look at. Now, fortunately, there are simple ways of testing and understanding if in fact you might have a protein deficiency, a difficulty in processing proteins. There are trigger points throughout your body that help us understand if in fact these things may be happening. The wonderful thing is these tests are simple, they're easy, the response is very quick in nature, and you get to experience, as you do treat and correct your situation, you get to experience how those trigger points dial back because the body is performing better. Now, I'm going to ask you, you know what? If you're having and you think that you're having difficulty in processing proteins, I want you to contact the office. We always start with the very first part of the process, which is we seek to understand exactly what's going on. And we're going to go ahead and we're going to fill out a signs and symptoms report so that we could better understand some of the things that we probably don't see in the office on a daily basis. Like how you're consuming, other medical conditions that maybe you haven't told us about. Maybe if in fact you're starting to take different medications that you hadn't made us aware of, what those medications happen to be and what they're for. The signs and symptoms questionnaire will help as we step into palpating and stressing the system by checking different trigger points to help us better understand what are the things that are going on that then need to be fixed and corrected, and then capable of circling around and retesting those parts so that we can monitor as your body is performing better. You know what? As a chiropractor, we work with patients with all types of bone health issues. In this case, as you guys realize now, protein deficiencies may be one of those things that are causing you to experience some of those breakdowns within the bone health of your body. Our desire for you is to detect those things early, to make sure that you're enabled and armed so that you could help yourself recover and stop the effects of that protein deficiency as quickly as possible before we see a crisis set in. As always, I appreciate you being here. I'm Dr. Joseph Baker from the Limerick Chiropractic Center. Have a great day.